Hi, I'm David Hackam, and I'm the Chief of Pediatric Surgery at the Johns Hopkins Children's Center and Professor of Surgery at Johns Hopkins University. And I'm a proud recipient of a resident research fellowship from the SUS, which in many ways launched my career. At the time that I was a surgical resident at the University of Toronto, I knew that I wanted to be an academic surgeon. I knew that if I needed surgery for myself or for a relative, I'd want a surgeon that could think outside the box, that could innovate, and that could find solutions for their patients. And in order to do that, I would need the tools to perform surgical research in a very structured way. The SUS resident research scholarship that I received from the SUS Foundation gave me those tools and gave me that opportunity. I performed that research in the lab of Dr. Ori Rothstein, and that research gave me two things. First, it gave me the skills I needed to be a surgeon scientist, to build upon, to have a career in academic surgery, which I've enjoyed since. But it also taught me that in surgical research, no matter what the research is, whether it was bench research or outcomes research or education research, you have an incredible opportunity to help not just the patient in front of you, but to help a whole generation of future surgeons and future patients by discovering new knowledge and applying that new knowledge to your patient's needs. And so the SUS Foundation gave me those tools and affirmed for me that I wanted a career as a surgeon scientist. So today, as I look back on that time as a surgical trainee and as the recipient of an Ethicon Research Award, that's what it was called at the time, I have the opportunity to advise other trainees, to advise the mentees in my lab. And every year at around this time, we put together an application, just as I put together some 20 years ago, for an SUS resident research fund, knowing that if my mentees are successful in receiving those awards, those generous awards from the SUS Foundation, their careers also will be launched, and they too will impact patients that will need their help and will need their innovation and will need their creativity. And so I ask you to consider my story as the story of surgeon scientists everywhere for patients that need our help today and in the future. What drove me to do a career as a surgeon scientist? A couple of things. First, curiosity and the recognition that surgery in and of itself is an extremely fulfilling profession, and in many ways it's a calling. But also the patient in front of us really doesn't care what's in the textbook. They care about getting better. And if the solution for that patient's needs is not in front of us, it's our job as surgeons, and in particular surgeon scientists, to find those solutions to help those patients. And that's obvious to residents and trainees at the earliest of their training because they are asking us those questions. And as a surgeon scientist, we get to answer them. And the SUS Foundation gives us the tools to do that. The SUS was, at the time that I was getting involved, the premier place to discuss research, to be part of a community of surgeon scientists, and really to make an impact on the field. This was some 20 years ago. And at that time, my mentors in surgery were proud members of the SUS. And that was the place where we discussed our research. This is before this incredibly successful project that we call the Academic Surgical Congress in partnership with the AAS. And so at the time, the SUS was the place for surgical research to be presented and for surgical innovation and creativity to flourish. And it still is. Certainly the Ethicon SUS Award affirmed for me my passion for surgical research. And you know, the word passion is sort of overused in many ways, but it did sort of give me a pat on the back because research is very difficult, and failure is a constant force in all research, but especially basic science research, where many things, especially when you're just starting out, don't work. And having the SUS Resident Research Award sort of gave me a goal, and it gave me sort of a greater purpose, because now my work was going to be presented at the SUS. There were people that had invested in me, and so now I was doing this for others. It was certainly no longer just about myself. And so that was sort of the biggest, I would say, aspect of this award. I was very honored to receive a very prestigious award. It gave me the opportunity to interact with other SUS residents who remain lifelong friends and colleagues now to this day. And that was sort of the key measurable, I would say, besides the money to allow the research to happen. That was sort of the key tangible. And I'll just tell you a story. I was at a recruitment dinner for someone, as the chief of pediatric surgery. Recruitment is a big part of what we do. And there was another individual at that dinner, and this individual was in the interview process for the Ethicon Award with me. At that time, there was an application, and then there was an interview process, and then there was a finalist. And we were applying for various awards at the same time. And of course, in a sense, we're competing. I was coming from Toronto, he was coming from US program. And we've remained friends to this day. And we look back on those experiences, and our careers clearly started from that common point of surgical research and a commitment to taking this time out to do surgical research. And I think that is a story that anyone who's received these awards will tell you, that it gives you a community of like-minded surgical investigators that will be lifelong colleagues. And there's nothing quite like that. I think the most significant impact is twofold. First, there's a body of work that we've been fortunate to put forward into the community, and my focus is on a disease. It's a surgical disease that affects premature newborns. It's called necrotizing enterocolitis, and it's a devastating condition. And through our research, we've been able to explore what causes it and come up with novel therapies for it that are in preclinical studies and undergoing licensing by interested partners. And that all stems from a body of research that started with this SUS award. So there's no question that that I would say has been the most satisfying and hopefully the most impactful legacy of that investment that the SUS made, that we're really making inroads into this disease. But the second and perhaps most important impact has been on mentees. And through my lab as a surgical translational science lab funded by the SUS early on as a junior faculty award winner, I've been able to attract mentees that have gone on and presented at the SUS and attracted others to the SUS. And I'm proud to say that my current residents in the lab, surgical residents, are the residents of individuals who themselves were in my lab and are now their program directors and shared in the funding from the SUS. And so this has been the greatest impact, that the SUS can make a commitment and an investment that carries forward over time, really through my mentees. And I'm really, really humbled and fortunate to be able to say that. It's a very satisfying and very difficult job. And so in the moment, it is a job. And like all jobs, there's good days and there's bad days. And it's difficult to sometimes enjoy the work that we do because of all the demands on a surgeon's time and on their skill. and on their health. But if we take a step back from that, and this is where my advice comes in that we must be intentional about taking a step back from that. We realize how lucky we are to do what we do, that people come to us in their most vulnerable state, which is when they're not in their best of health. And we get to do something that no one else can do, and that's to restore people to health through our hands and through our minds and through our eyes and through our training. And very few people get to do that. And if we think of the people that we respect in our life, that are people we interact with or people we see in sports or in other avenues of life, um, the things that we probably respect in others, that they're making an impact and they're selfless, if we take a step back, that's what surgery is all about. And I think that's why society at large holds surgeons in such high regard, because we get to help people in ways that, quite frankly, no one else can. And so my advice is, in the moment, we're doing our jobs, you're caught up with our jobs, and some days you just want to get through the day and you just want to get home. But when you take a step back and realize what you've just done, it's it's pretty amazing. And whilst life is not all rainbows, uh, there is a rainbow there, and that's a rainbow of hope that we can give our families. And my advice is, don't lose sight of that rainbow. Don't lose sight of what we get to do, because there are many people that wish they could do it too. So my first message to donors is thanks. Um, there's never uh, extra money in people's budgets, especially now, and it really is a zero-sum game. And so if you've donated to the SUS, whether you're an individual or you're a patient or you're a company, you've made that decision at the expense, literally the expense of other opportunities to give. So thank you for giving your precious dollars to the SUS Foundation. But also, I would say that it is my hope that you'll see that this is an investment. It's not a typical charity. It's a true investment in the future. And it's in the future of surgery, it's in the future of patients, and it's in the future of trainees. And so when we think about return on investment, I cannot think of a greater return than on those that are sick and that need the help of surgeons. So thank you so much for that investment.